Okay, this is variations on the Mulligan tibial external or internal rotation for any kind of knee pain. I find it works very well for patellofemoral pain, regardless of the cause, whether it's coming from the hip or the ankle, or there's actually issues in the knee. So Mulligan found that around 9 out of 10 of the cases, if he applied and held in a tibial internal rotation, and then the patient could actively flex their knee, or you could even just passively overpressure it after an active flexion or extension, it would improve any of the limited motions, whether it was extension or flexion. So normally I test this if the patient actually, say, had pain here, and possibly whether or not it was a hard end feel or an empty end feel. That would be your asterisk sign, or what you would want to improve. So then you would grab the joint as proximal as possible and hold the internal rotation, then it can actively flex, and you maintain the internal rotation the entire time, and at the end, if possible, you should do a little overpressure. It has to be 100% pain-free, like any Mulligan technique. And again, he found, and I've repeated this clinically, whether it's anterior, medial, lateral knee pain, posterior, internal rotation often helps. You can try external rotation, but it is rare that external rotation would help, and it's most likely because many PFS problems are a result of loss of dorsiflexion and weakness in the hip or gluteus medius. So weakness in the gluteus medius, you want to stand up? Sure. Often manifests itself physically. When you do a single leg step down, you would see that the knee would just drop inward. So relatively, if the knee drops medially, it causes excessive pronation at the ankle, and relatively the tibia would be externally rotating. So Mulligan would hypothesize that it's a positional fault at the tibia of external rotation, and that's why internal rotation would improve. So immediately, just to restore function, I would, after doing its non-weight bearing, I would progress to weight bearing. So just get out of the way, otherwise I would be in front of the patient. Again, you position the foot to be either straight or slightly external. So you do want to go in a line over your second toe. So again, saying that hurt, whether it was a lunge or a single leg step down or even a bilateral squat. Then you hold the internal pressure into rotation pressure, and then you have them repeat the motion. And again, if this makes 100% pain-free, you do 2-3 sets of 10. Now, variations on this, again, the rules is that it should be 100% pain-free. So if you cannot get it to be 100% pain-free, you can change your hand hold. So if you could externally rotate the femur while you're internally rotating the tibia. If it's more medial knee pain, sometimes I try to do a bit more of a shearing, which would almost promote, say, like a valgus force. So I'm actually shearing like that. I have improved certain lateral knee pain by reversing that for more of a varus force. And again, you can also do that with external rotation, although again, I find that very few patients get better with external rotation. You can also try varying the hand holds, more proximal, a little bit more distal. You can increase the force, or you can actually even decrease the force like any other Mulligan technique. So, change the hand hold, change the direction of the force. Maybe you have one hand higher, one hand slightly lower, so you're doing a little bit more rotation this way or a little bit more rotation that way. And make sure you always guide the patella over the second toe, because if you're doing this and you're guiding them medially because you're pulling internally, that kind of defeats the purpose of it. So make sure to keep the patellar tracking correct. So 2-3 sets of 10 of this, and then retest it, and if they're better, that's great. How do you keep it? The patient can easily do that at home. They can just grab their own tibia, say if you stick it up on a step, you don't have to bend down as much, and then they can just hold, make sure I instruct them to twist the skin until the skin stops, then twist a little bit more, then you're providing a little bit of force to the bone, and then they can just do that and go into overpressure if need be. So I'd have them repeat that several times a day, maybe 4 or 5 times a day for a set of 10.